There we go. So who wants to start?
I'll start. I'm Cherry Houston. Am I muted? Okay, I'm Cherry Houston. I'm from the Nashville, Tennessee area. My organization is Critical Learning Systems. I'm a NOC member. I'm just recently selected to the board of directors for Encompass Solutions, and I'm on the finance committee. And I've been an NRT lead for probably 3, 4, we didn't call it that then, but we started the data measurement group years ago. So that's me. Ellen, you can go next.
Hi, I'm Ellen Hyman. I'm the executive director of the Michigan Oral Health Coalition and head of the Disabilities and Universal Inclusion, NRT. And we started that almost a year ago, a year next month. And so I think it's been really good. We have worked on, I guess, had discussions on lots of different ideas. And today is a not a school day, so you need to watch them. So I have an 11-year-old here.
Hi.
Say hi.
I got an 11-year-old in the other room.
She has a friend over, so I'm like, you need to wear a mask. So anyway, so I'm hoping this year that we like tackle more things, get more accomplished. The big thing I want to do is really, since Houston's here, I'm gonna, since the data team's represented, we want to really look at data for people with disabilities. We have a lot for people with IDD, but not other disabilities. So I would like to work on that this year.
Cool. How about you, Christy?
I'm just sharing my name and my NRT. That's
Yeah,
it.
your name, where you're at. Yeah, and then any aspiration you have for the NRT.
I'm Christy King. I'm the association executive for the Southeast Michigan Senior Regional Collaborative here in the Detroit area, in Michigan. I lead the Health Equity Super NRT along with Zeal, which is our new co-lead because Makbupa has moved on to the Encompass board, which is great. She is still a part of it. We started this NRT in 2020. Is that right? September 2020, something like that. So we're a little over a year into all this. For us right now, we're going to be looking to continue to strengthen the Health Equity Super NRT and what it means and connecting it to the open network as a whole, as well as Encompass. So really putting some more tangible pieces together. So we're not changing things, I'm going to say, but we're going to make them much tighter.
Bold aspirations. So you three are the NRT leads that have joined us today. I'm not sure if others will be popping on. Yeah, go ahead, Grace.
Do you want me to represent for public perception?
Yeah, go for it.
That's why I was here, actually.
Cool.
So I got to smack John Welby across the head and say, where are you? So I co-lead the public perception NRT with John Welby from Maryland. And I'm in Colorado. And I'd say aspiration is for the public perception NRT has been really looking at promoting Open's website and increasing the network's visibility, in a broader external facing way. And so they've landed on blogs, and I'm very excited because they're starting to really gain some traction around some blog posts. Also, they have an eye to the blueprint work and specifically the Amplify Consumer Voices lever, but just the blueprint in general and making sure that, we're connecting the dots between those pieces as part of the NRT's work. Thank you.
Nice. Bianca Rogers, do you want to rep the policy NRT? I totally forgot that you even still do that.
Well, yeah, for the time being. So hi everyone, Bianca Rogers. So Colin and I are actually stepping out of our lead roles ultimately, and so we're hoping to get someone oriented to take it on. But for us this year, it's really going to be focusing around midterm elections and then prepping for Hill visits, most likely in early 2023, as new members take their offices. We'll want to do a meet and greet and also talk about why they should be thinking about oral health. So that's what's going on there.
Cool. Cool. So I'll go ahead and share my screen and we will jump in. So why am I adding a slide? I just want to view a slideshow. Good. So our time today, I know that you all have been around and this is, not your first rodeo. So we'll go over a lot of the open stuff just very briefly, but we mainly want to help shape your thinking for the year, really framing everything in the light of the open blueprint for structural improvement, which is our shared collective action plan. And so how we kind of support that, weave it into our work. What does that look like within our network response team? Also, we'll be reflecting on open as a multi-hub network and how we can connect with other groups to strengthen our own individual teams and one another's teams and the network as a whole. We hope to reach agreement on how we'll communicate through the year. Spoiler alert, it's open communities. But we'll take some time to dive into there and show you where things are located. And everything is leading up to a brainstorm where we can all kind of think aloud about what our plans are for the year. And so with that, I will hand it over to Bianca Mieses to do a quick open grounding.
Hi, everyone. If things ever get confusing when you're on calls with Bianca Rogers and myself, feel free just to say yes or Rogers, we'll answer. So oral health is a justice issue. As you all know, that's kind of why we're here. That's how we've started. We believe that it is fundamental to the work that we do as a network, and many of our members find this to be a value that they're really rooted in. And so I will go to the next slide. A little bit of our history. Again, some of you may know how we began. We had the oral health. Wow, I can speak. I can. We got this. The surgeon who declared a silent epidemic, and that was also due then to the young boy, the gentleman, Diamante driver in Maryland, who died from untreated dental absence. And so this tragedy, of course, led for Maryland to kind of lead in creating state level systems change. And fast forward 2009, the ADA, along with other organizations, U.S. National Oral Health, and then comes DentaQuest. They decide, hey, you know what? Everyone else should be replicating this in all states, and let's move the needle forward for oral health. And so then that's how the OH, which is Oral Health 2020 Network, was created. And since then, we've rebranded as to OPEN, and which stands for Oral Health Progress Equity Network. I knew that. And so that's where we are. I'm glad the OH 2020 came off, because we are now in 2022 and we're still pushing forward and we're moving this needle. And as you all know, we have about 3,000 members. Actively, I would say Francis Carly could drop a number in the chat, what that number would be, because I probably will make one up. But if we go to our next slide. And as you know, equity is in our name. It is, again, another fundamental value of ours, as well as the network has done a lot of work in defining what this means to open. And so the Health Equity Work Group in 2016 went ahead and provided a definition for the network. And it's really just to the attainment of the highest health for all people. And then we moved into the JEDI statement. And so this was also birthed from the Health Equity Super NRT. Shout out to Christy King, who's on the call. In 2021, they different working groups and team members, and teams and different people throughout the network and really felt it was important to call out justice. And so that is why it became the JEDI, which is the Justice, Equity, Diversity, and Inclusion Statement. Again, it's commitment oriented. It requires for us to have an ongoing practice of critical reflection, and it's a living statement, and it brings us back to our original why and helps us see the bigger picture always. As many of you know, some of our core values are in our name, and so we believe that obviously oral health is essential for everyone and for lifelong, and that it is preventable. Oral health diseases is preventable. So despite the ability of effective prevention and treatment, we have seen little improvement in growing disparities in the nation's oral health status over the past 2 decades. And so our vision here is that communities thrive, for oral health valued as essential to well-being, and equitable opportunities ensure that everyone realizes their full potential. Some of the methods of collective impact through networks is defining a common agenda. I think we kind of all know why we're here, is for oral health purposes and reasons. Another common agenda that we've all come to is this blueprint, this magical blueprint that is our roadmap at the moment, and kind of our hopefully our North Star. So develop shared measurements. And I think that's kind of what we did individually as hubs, is develop ways to measure that. Participate in mutually reinforcing activities, and facilitate continuous communication with feedback loops, right? So finding ways on how we can continue to share, be redundant, but get this message across to all these 3,000 members, as well as to all over across this nation. And I will pass it over to Frances, who will go a little bit deeper dive into the actual blueprint.
Thank you. I think that's going to be the theme for today and perhaps the next couple of weeks, but it's just redundancy. And so making sure that all of this information is drilled home. You will have a pop quiz at the end of this, so make sure you're paying close attention. But so the open blueprint, as you all know, it began in roughly August of 2020 when we pulled together a team of network members. It was an open call for anyone to join us to map the existing national oral health system. So when we got started, the first thing that we did was to develop an aspiration statement, which was our guiding star to keep in mind as we navigated the entirely complex world of systems. But so that aspiration was to create an equitable, affordable, and accessible oral health system that produces quality outcomes across the lifespan. So that's what we're here for. This is the map of what the actual system was. So the care, what we see today is healthcare is a business. So that's where the core story was. And so from there, we know that we have business structures and they function really well for dominant groups who are able to access them. There's been a legacy of separation, right? Dentistry and medical have been siloed. And we have an inadequate infrastructure for marginalized groups. So that was the primary story going on. But then we also noticed, right, that there is a bright spot that has been forming through public investment and innovation that has led to gains in preventive science and administrative improvements, as well as advocacy opportunities. And so we identified that as the very first area of leverage, right? If we can take advantage of these advocacy opportunities, right? If we can amplify consumers voicing demand for change, and we would be able to really make some changes happen. So that amplify consumer voices was the first area of leverage that we identified. And I'll move to where the others are. That's the core story said in a different way. I just told it to you with the map up. But so the areas of leverage, or the levers, are amplify consumer voices, advance oral health policy, integrate dental and medical, emphasize prevention, and bring care to the people. So once we identified those areas of leverage, we brought those to the network and we said, what could you do in these leverage areas? Like what is it that we could do together to make a change in the system? So if you recall, this was back I want to say in October of 2020. At our national meeting, we asked everybody to come up with some leverage hypotheses. So they were the if-then statements. If we do this, then we believe this change would happen. So everyone, it was a free-for-all, just submit as many ideas as you can. We came back the next day, and then we were able to evaluate each of the ideas that came through. So we went through breakout groups. And then folks were able to say, do we think that this is feasible? Do we think that this is sustainable? Do we think that this is the right fit for the network? Is this the right fit for my own organization? Does this promote equity? Is this inclusive? Right. So we ran it through a whole bunch of trials, and from there we were able to reach our strategic interventions. So those were vetted, those were socialized around. We had the senior advisors for CareQuest work with us to refine those and make sure that it made sense. They all work together. So those are the levers and the strategic interventions. We brought the strategic interventions to Open Academy last year. That was, I believe, in June. And that's where we asked the network for some action steps. So how could we actually, like, what are we actually going to do to move this thing forward? So people submitted national, state, and local action steps. It went through that same process to evaluate, is this feasible? Is this sustainable? Does it promote equity? Everything that we're looking for. And so that's how we came up with our final set of action steps, which have now moved to the lever leads. They were onboarded just before you guys. So we have built a national multi-sectoral network. We've mapped the system. We've identified levers to create maximum impact. We have some strategic interventions within those leverage areas and action steps now to implement the strategies. So from here, the role that the lever leads are taking on is to build that shared measurement system, package the change strategy, and then what is our implementation and evaluation structure so we can carry out this work together. So that is like the main thrust of what we're up to with Open. We have everything ready to go to collectively act. And so I'll pause there and see if anybody has any questions.
So the lever leads will engage the network directly, correct? I mean, so I'm just trying to understand how will they, I mean, I guess in my brain, I know, but they'll just engage the network directly, like, and they'll request, let's say, Amplify Consumer Voices will host a meeting around amplifying consumer voices and creating a strategy and develop within. So it'll kind of just be another meeting on the calendar, so to speak.
Yeah. So what they're doing right now is like they'll go into the action steps themselves.
Mhm.
This is what we were sharing. Can you see my, can you see this spreadsheet?
Yep.
So I'll zoom in a little bit, but they're going through the action steps, right? And then we had people say what they had the most interest in, see where the energy was. So we're giving them these as like kind of, these were the priorities identified. So now how can they make smarty goals around these, right? Like what are we actually going to do to carry this out? Right. So if we're going to join other consumer groups to learn about their issues, build relationships, promote ways to integrate, like what does that look like at a networked level? Right. So they're going to start to think through those. And once they have something solid, they'll bring the network back together. And so that could be like, a take 30, a take 60. It could be like a, you know, like a intensive brainstorm. Like, I think it just depends on what it is that they're running into. And, but yeah, we're making sure that the network stays informed every step of the way, and then, you know, make sure we get as much input so that people are on board. I don't know if that answers your question, but they are thinking about how the network gets engaged.
Yeah, I guess, I mean, and I don't want to put a lot of time, but I guess I'm just trying to put in my brain how that will take place, but I'll wait to see. I'm in no rush. I just was wondering the implementation of that.
Mm-hmm. Cool. Are there any other questions before we move along? Okay. So I will hand it back over to MSS.
So we'll talk a little bit about our infrastructure. As some of you are aware, again, going back to this blueprint, our map, our North Star right now, it's the middle, right? It's kind of, it's what's driving us. And so underneath we have our NOCT, who is our National Oral Health Connection Team. So they work on their network leadership and supporting strategy hub. If we move over to the right, we have our NRT leads, which is you all, and that is the network response teams, issue-based response strategy hub. We have our lever leads, collection action strategy hub. And then we have our ROCT, which is the regional oral health connection teams. And so they focus on state and local representatives and connection, providing connection and alignment through the strategy hub. If you go to the next slide, we will see that it's another type of map of the infrastructure and the multi-hub network that we are all in and a part of. So obviously lever leads, it breaks down to the 5 interventions, as you see that right at the top. Then if you move over to the right, you have the all NOCT. And so how the work groups currently, how they're structured, how those break out into other areas of the network and are to feed into other areas of the network. We have further down to the right, far right, we have the NRT leads. And so again, this is the hub you all are a part of and the different areas of interest in different NRT groups. And then we go over to the ROCT leads, right? And so those are broken down by region with how still having state and grassroots representatives in each of those regions, 2 for each state. I hope that's not too confusing. I know when you look at it, you can get a little dizzy, but if you stare at it close enough and intentionally enough, you can kind of see how everything is interconnected and should be. And so the contingent infrastructure, the importance of wide bridges, we have here ways of, we think of it of kind of like of spreading information, right? Something that's contagious. And so an example I used at the last call was a movement, and specifically the one of the gay rights and equality. And so it was when Facebook decided to do, you know, on your profile picture, you could use the rainbow or the equality sign or something of that nature. They had just a few different options there. But really, when we saw more people do that, people were more inclined to do it as they saw more other people do it, right? And so we are impacted as by behaviors as humans. And so that's kind of what the Wide Bridges is about. If we continue to share, if we bring it back to open and the network, if we continue to constantly share, whether that's via OC, more people seeing things go up in different groups and different hubs and different discussion posts, and sharing in many different ways, more people would be inclined to do so. And we'll go into the next phase. Ongoing connection, mutually reinforcing activities. Again, this is another example of Wide Bridges. And so we had our 2018 Open Milestone Report, our Hill Day in 2019, and Policy Summit and Virtual Hill Day in 2021. And so then the Health Equity Super NRT is also an umbrella group made up of representatives of all open hub teams and subcommittees. And so this group constantly is making sure that we're staying on track when it comes to equity and integrating that in our messaging and our framework and all that we do and how we view it all, and how even the perception of the network and any activity that we're involved in is kind of keeping that that equity at the top of mind. And so I will take us into open communities. How many of you have not navigated open communities? And it's okay. This is a safe space. We won't judge you if you haven't. That'd be nice if I took us there. Okay. So here we are in open communities. If you haven't navigated this just yet, we strongly encourage you to do so. It is our platform. I repeat, it is our platform to use consistently all the time. And so we have here community discussions. Again, this is where everyone can post anything that any resources or information that you think would be helpful for the entire network to know. We also have here to the right open events. And so there's always going to be a list of meetings, things as such, links you can find there. So if we also go into Take Me to Communities, which you can also find at the top, communities. So open wide is the entire network. And then here specifically, we have the NRTs. Again, we strongly encourage, I know that sometimes we had I think it was a roller coaster, I'd call it, of moments of where we feel like the discussions or the communities were used. We really want to encourage that and really push that out, being that we're on I wouldn't semi-new platform. It just looks a little nicer. And so we really want to take advantage of it, of all that it can do for us. And I believe we even have one, if I could be mistaken. Okay, I thought we had one just for the leads, but I could be wrong. So yeah, we want you to use this as much as you can. So if you haven't joined, please join. If you're having some issues, reach out to Francis or myself to help you out with that. And again, continue here with, yes, it's right here at the bottom, network infrastructure, so former leads. You all as leads, we heard this last year, especially coming from the ROC leads, on wanting ways to just connect with just the leads or also with NRT leads. So we have created another community here just for the leads to communicate as well. So with that being said.
Quick question. So when we get a message, an email message, and it'll say James Doe wants to join the Health Equity Super NRT group. I don't know what that is. What am I supposed to do with that? Is that going to everybody, or is it a reason why it's coming to? I was confused.
Yeah, you were my trial community.
Oh, okay.
I didn't know that those emails were going to you. They also go to me, so I approve people.
Okay.
I'll try to find a way to make that stop.
Okay. Well, you see, I didn't touch it, so I'm good.
Cool.
So you left them out in the cold, huh, Christy?
Hey, I figured France was on the back end doing something, so I left it alone. Don't touch what you're not sure about.
She said you stay out to dry. Also, in each community, you can decide on how you receive the information, whether like you can have it daily digest, weekly summary, and there's one other that I am forgetting.
Immediate email.
Every post immediately and limited. Yeah. So weekly, daily, every single post, you can decide how you get notified for that. So I encourage you to kind of find what the best route would be for you and how you like to receive and digest information and stay up to date on what's going on.
Yeah. So if you go in and go to communities and go to whichever community that you want, so you can change your subscription so that every post, daily digest, weekly digest. Also, the daily digests that come right now, you'll find if you click the link for it to show you more, it won't show you more. We are working on that and on the back end, but for now, if you select every post, that you won't have that issue. It'll like all the content will come through. So make sure you get all of your preferences up to date. And also what I just noticed is that the policy NRT has 8 when I think the roster that I uploaded to the system had like 108. So if your committee count seems off, I can share those with you all, and then let me know if there's folks to be added, which we can do manually. We're not asking you to join. You don't have to join in, but if you want to, except for the Health Equity Super NRT, we ask that there's representation from all different groups to be part of the Health Equity Super NRT. Okay, so let me get back to the right deck. Here we are. Okay, and I think I'm taken back over. So are there any questions about open communities? And now we're going to ask for an open commitment that this is where we communicate. So we communicate amongst ourselves, right, within our own network response team communities. We do have the NRT Leads communities if you guys want to ask any questions of one another about, like maybe what it's like being an NRT lead, what other folks are doing, or if you want to engage with one another, if you want to share out a resource, or ask for more information or anything like that. But then also holding ourselves accountable to communicating with the network, right? We have that open wide community for all folks to join. So with those things to consider, are there any ground rules, anything that's coming up for you? But we wanted to take some time now to reflect on our continuous ongoing communications.
Yeah, I had a comment. I wasn't sure where it would fall, but Ellen mentioned something about data for people with disabilities. And several months ago, sometime before the first of the year, Ellen had sent me an email about connecting with possible data related to this. And we discussed it in our data measurement meeting. And Chris responded to her with the data that was available. But she said something just now as we think about the 10 data measurement webinar series that we're engaged in right now. We started this in January and we're about to do our third one in early March. And it might be coming later on, but as I think about the data measurement group and where we go from here, these are so interesting and good. It's about how communities are engaging data to advance their equity work or their work. And so I'm thinking this could be a annual thing that we have these 10 different data series or build upon what we're doing now. But she said something about finding more data or wanting to work with acquiring more data for people with disabilities. And I'm not sure if that is something she's looking for or something that she's engaged in now, or I just happen to have a conversation with Dr. Wansu M, who did a lot of GIS stuff for me when we were developing the Oral Health Needs Index. And as I combine this with the internship program that we're just about to onboard, and he mentioned interns that he has available at Meharry Medical College that would help us with this. And I'm wondering if this is a way to marry or bridge some data measurement stuff with this new internship program we're about to launch and with the needs of someone like Ellen. I mean, it just made me think about that. And maybe we could be looking at how we really capture these data webinar series and really apply what we're learning from them to real life situations within our own network. So.
Yeah. I think what you're speaking to is a mutually reinforcing activity, which is a beautiful example of building a wide bridge, right? So I think whatever it is that you all can do to kind of share out what's going on it's more than likely that you guys can support one another and you know, work together to create something that's needed.
Right. And I think it addresses the capacity building, organizational capacity building as well.
Mhm.
Yeah.
Mhm.
Okay, well, I'll shoot Ellen an email, and Ellen, if you're open to that, then I'll pursue that a little bit further with you.
Mhm. Even better if you put it on open communities and you can start a community conversation.
Exactly.
Yeah,
And I just
sure.
wrote myself a note to join that community. And if you'll send me a link to that, Francis, I would do that. Yeah.
Cool. Okay. So we have one last part to get through before we have a full open brainstorm about what we can use this year for. But we wanted to get the Smarty goals back in front of you. So I'm sure all of you are familiar with SMART goals, that is strategic, measurable, ambitious, realistic, and time bound. So the Smarty goals, which we have committed to using in this network, also includes inclusivity and equitability. Is that a word? I'm not sure. But so we want to make sure that we bring in traditionally marginalized people, particularly those most impactive, into the processes, activities, and decision making in a way that shares power. We also want to include elements of fairness and justice, seeking to address systemic injustice, inequity, or oppression. And I'll share these with you as well. And we have like a little template to create some Smarty goals. But just thinking, you know, what it is that you, as an NRT lead, want to bring to your network response team. We have noticed through the years that when network response teams have specific things that they're called to work on, more people tend to show up. You see the same faces. When it turns into like an open, like, hey, what's everybody want to do, or whatever it is, we tend to see like attendance fall off. So we're recommending, you know, developing some Smarty goals for your teams, and of course having the teams be a part of those development. And another tool that is available for you is the open virtual meeting prep checklist. So I will include a link to this, but it's basically like step by step what needs to happen, including, you know, PowerPoint templates, agenda templates, and, you know, how and where to post things, and what to do before, during, and after. So I believe those were the main tools to share with you. If there's any questions there. Okay, hearing none. So we'll use the rest of our time together just for an open brainstorm. We're just throwing anything out there, but what does successful engagement look like? So I know everyone has, you know, varied participants, varied membership. So what has been successful for you guys in the past? Any way that you can think for the network response teams to support the open blueprint? Any ideas on processes to develop some Smarty goals? How often do you think you all should coordinate with one another, with the other teams? And any other questions that are coming up? That's the rest of our time together. So I'll stop my share so we can see each other. But what's coming up for you guys?
I'll just go first because I have to log off, repping the policy NRT. But like I mentioned before, I think our primary focus this year is going to be midterm elections. That's probably going to look like a form of the toolkit. But of course, with the lever leads now coming up with some specific measurements and action items, to start implementing in 2023, I think, you know, we're going to be on the lookout for as much information as we can get on that. And then if they're needing us to help inform them on anything like current policy and environment, then we can be ready to do that as needed as well. In terms of, we've been meeting mostly monthly, but could probably switch to every other month, just depending as things get ramped up or slow down. But I think another thing, it would be great to know what all you are doing in your NRTs too. And I think policy is much more of an open net. So, is there policy for, that needs to be done around data, or that needs to be done around individuals with disabilities? And so feel free, like, as things like that come up, reach out to us and see what we might be able to lend or resources we might be able to create aside from the ones we already have in the pipeline.
Well, I guess I could have held my comments about what we were doing in the data measurement group for this section. So other than what I just previously mentioned, the 10 webinar series that we've launched starting in January, and the third one will be early March. And just now, what I just said again, just connecting with you all regarding data needs, and just some things I just heard from Ellen about some areas that we can have an impact that I'll post on Open Communities. But that's what we're up to. And I think these are going to run through June or so. And we typically meet every month, and we didn't meet last month because of the series going on, and but we'll probably meet again in March.
How about you, Joni? I see you were able to join us.
Hello, friends. I think one of the main things we've been working on is organizing ourselves around the levers and identifying actual deliverables for the rural NRT. So the last 2 meetings that we've shared together, we kind of organized what practically some of us are already doing around rural oral health. And we've kind of categorized it, by opportunities that already exist within Open. Like we hear about a lot of Take 20s. Cherry just talked about, the data series. So there's different things that the Open Network does that we're kind of accustomed to. So we talked about some opportunities that we could take advantage of, like hosting a Take 30 around some best practices for rural oral health currently right now. We've shared some resources already through Open Communities. There was a NIDCR report that came out in December that had a lot of specific content around safety net, underserved, and marginalized populations, which is really important for us as it relates to policy. And I can't remember, I think the policy NRT lead was discussing that. So we have another action item where we want to host some roundtables with some of our local and national leads that are part of the National Rural Health Association. And we hosted a colloquium almost a 1.5 years ago with the rural NRT. So rediscussing some points that have changed since our legislation has approved different things as it relates to federally qualified health centers and inclusion of oral health. So we know that that will be a very particular activated set of roundtable series that we're hoping as a deliverable, we'll be able to take that to the National Council of State Legislators as some recommendations around rural oral health. So that's kind of in a nutshell what our group we're intending to do, and have kind of written down some of those targets as our goals for this year. I think, Francis, one of the things in our rural NRT group, because it's a pretty niche group, we have all found that we like to use calendar invites, which sometimes Open Communities, it will remind you and send you the updates as you would like, kind of like Bianca was describing. But we actually send out direct, like Outlook and Gmail calendar invites, and it gets it on their calendar, and they seem to be able to keep up with meetings and keeping them a little bit brief. has been effective currently for us that we found with just communication and things that we're working on.
Great, thanks for sharing. Ellen, Christy, Grace.
I feel like I shared a little bit about some of the things we're doing. We're also, in terms of data, we're also working on some like nationwide policy issues, like hospital access for people with disabilities. So getting care under general anesthesia in the hospital, which Stacy and Lori Norris were working on, like working with CMS on, and kind of brought it back to us. But it was so something that I certainly in Michigan had been working on. I think people in other states. I have been feeling like I need to like study all like the levers and think about how we can support that effort, because I haven't really kind of thought through how the NRT connects with that. So when you send those documents, I'll have to study them and think about that.
How about you, Christy?
Well, a couple things that we're looking at as we look to kind of reorganize. I hope you guys can hear me. Reorganize the NRT is one is we're going to be focusing on member engagement and retention. Another thing we're going to be focusing on is the health equity curriculum that Stacy is spearheading. We're also going to be looking at how we can support, if we're going to have convenings and such, how do we make sure that we're playing a part in supporting that. The other thing I think we're going to, and all of that, we're still going to keep our whole integrated education accountability piece is going to be wrapped up in all of that. The other part of, the one thing I that we did not take into account when Jill and I met was how we'll support the blueprint and the levers and all that good stuff. So that's something that we need to dig a little deeper into. So that's pretty much what we have going on. We're looking for consistency. We're meeting every month right now. Not sure we'll need to continue that. Just depends on what we have going on, I think, as well. I like that idea. I think Joni mentioned about sending the invites in different ways, not necessarily just through open communities. I think that's a really good idea. So that's pretty much where we're at right now. We want to simplify things.
I like it. What about you, Grace?
Yeah, thanks. Sorry, I had to run and put the dog in a quiet place. So measurable or successful engagement to me means some measurable outcomes. And, I for public perception and RT, that's thinking about success stories, the blog, other stories, how we share those, how we share our stories of impact. And so I'm hopeful that we can focus our attention, in that space. Like, we all have these amazing things happening. A good example, I think, was the Medicare toolkit and policy work, and, getting the network kind of rallied around, a common project and cause. And so the blueprint, I'm thinking, is going to be a space for that to happen. And really having an eye to success stories and sharing the actual, what's happening because we're here type of thing.
Yeah. So I think with all of that in mind, and kind of like, how can we support the blueprint, right? Or at least keep people informed of what's going on. Or even if it's like, if it comes up in a conversation with the network response team and you have some piece of feedback that you want to feed to the lever teams, and have that incorporated, like everything that we do is open, right? But it's open-ended. It's always evolving. And I mean, when we come together and we build those wide bridges, right? We work together and we come up with all sorts of amazing things. So I think my aspiration for the year is just being more intentional about feeding information, kind of back and forth, being that ongoing feedback loop, right? Or the communications channel to make sure that people stay in the know, and I think for everyone, it's kind of, putting that out for all members, right? Like, here's what we're up to, a call to action, a call to join, soliciting feedback, whatever it may be. But everything through open communities, and just trying to bring as many people along. But so I know we have heard from everybody and we have 6 minutes left, but I mean, obviously we don't have to stay longer, but I do want to just keep all of that in mind. It's up to us to kind of be the leadership. And then we're trying to bring people along and bring people into the work and get them oriented to know what it is that we can do together. So I think as much as you guys can stay informed and stay up to date with one another, the better off we would all be. So I think that's all from me. Bianca, do you have any parting shots for the group?
No, I'm good. Thank you.
We-
And just, well, I'm sorry, just a little. I mean, we will continue to support you in the way that we have staff as staff. So we all have just divided and conquered, meaning Francis, Bianca Rogers, and Stacy and myself are still supporting the NRTs that we were supporting last year. So you will continue to have staff support in that manner as well.
And you know where to find us. So let us know however it is that we can support you all. And I would like to say it was nice to see your faces, but it's nice to see all your names on some black boxes. There they are. You got them. Okay. So thank you all for joining us.
Thank you.
Bye-bye.